Now here in New York State, Ebola preparations are continuing to evolve. Just hours ago, state health leaders met with the Senate Health Committee for a hearing on Ebola. This just one day after the state released guidelines for hospitals and health centers across New York. CBS 6 reporter Tori Wells is live in our Capitol newsroom tonight. And Tori, there is a timetable set up for that as well.
That's right, Dory. This is the order that the health department released, and it gives hospitals, health centers, and ambulance services 10 days from yesterday to get this plan underway. Now, we've been speaking with many of those in our area. We know they've already been working on plans. They've already been training. Well, today, the acting state health commissioner also said that his office will be visiting some of these hospitals throughout the state and health centers in coming weeks to check in.
An ongoing effort to try to make sure that the staff is protected in the emergency department, that the sheriff's deputies are protected, that those first responders are protected.
Health officials briefing the Senate Health Committee this afternoon on Ebola preparations. Just yesterday, the governor released statewide plans and named 8 hospitals that would care for possible Ebola patients, located geographically throughout the state.
We've actually begun the process of identifying and training a team of first responders who are our staff, who would care for any patient.
In Rochester, Strong Memorial says it's training a team that would care for those patients. That team would be highly trained and have access to extensive personal protective equipment.
We have a location and the capability to have a patient in isolation where they are separate from other patients. And in fact separate from healthcare workers, except for those who are designated to care for that individual.
That doesn't mean that preparation isn't happening here. The state has told all hospitals, health centers, and ambulance services, including those here in the Capital Region, to get ready. They need to be able to identify, isolate, and evaluate possible Ebola patients. That includes providing personal protective equipment, designating an isolation room, conducting training on how to use that equipment and how to screen patients, and creating a way to track interaction with a possible Ebola patient. These hospitals and health centers also need to create a transportation plan. That could come into play if a patient tested positive for the virus and needed to be cared for at another hospital. And you heard the commissioner in my report there. He mentioned the safety of first responders. That came up quite a bit in the hearing this afternoon. Now, the acting state health commissioner says efforts are underway right now to come up with more protocols for police and EMS, the people that could really be coming in first contact with a possible patient. Now, he also said that the CDC could be in New York City next week to see some of the designated hospitals in that area. We are live in Albany. Tori Wells, CBS 6 News.